With the experience and resources for cases throughout Louisiana, Walters Papillon Thomas Collins, LLC, is proud to support LPB, specializing in personal injury and wrongful death, with information at lawbr.net.
Thanks, Dudley, for that kind introduction. If my mom is still alive, I'd say she wrote it, but I appreciate that, and I would just say that accomplishments we have at Ochsner are all because of the great team we have and the folks we have around the organization. So what I wanted to do today is give you a little bit of background about Ochsner Health System and a little bit about what's going on in Baton Rouge for us, but then really dive a little bit into healthcare policy. So I'll try to make it very quick about what are the big challenges happening in healthcare today, and then end with Ochsner's aspiration for 2030. As we finish the last decade, we go into a new one. We want to think about, what should we be looking to do over the next 10 years. So a little bit about Ochsner. We're the largest health system in the Gulf South. We have about 1,500 physicians in the Ochsner Clinic Group practice. About 130 locations kind of around the region between our health centers and urgent care centers. We also are a large academic center. We actually, between what we do at Ochsner in New Orleans and our relationship with LSU and Shreveport, are the largest educator of physicians in the state of Louisiana. So we're proud of the work that's being done there, and we also, and I'll talk a little bit about revenue, we've grown pretty substantially over the past couple of years. From a quality perspective, Ochsner has always been known for this, going back to its founding in 1942 with Alton Ochsner. So regardless of which measures you look at, Ochsner continues to be in the top 1%. And this isn't just our Jefferson Highway campus, this is our entire system, including our organization here in Baton Rouge and our partner organizations around the region. So we're very blessed to be the #1 hospital in Louisiana for the 8th year in a row from U.S. News and World Report, and really the only organization in Arkansas, Louisiana, and Mississippi to be recognized in the top 50 from U.S. News and World Report, both in pediatrics and in adult care. In Baton Rouge, we've seen pretty substantial growth over the past couple of years. You can see we also made a large investment here, but we've seen our patient base now is over 100,000 folks that walk through the doors of Ochsner here in Baton Rouge at our Baton Rouge locations. And we've continued to grow from a physician perspective. Now have about 150 physicians in the Ochsner Clinic, as well as many who practice at our facilities, and a little over 1,500 employees that are based here in the Baton Rouge area. You may have seen this new location, one of our newest locations, the Grove, which opened earlier, actually about a year ago, and is the single largest investment and single largest project that Ochsner has done in the history of the organization, and it's right here in Baton Rouge. It's really a state-of-the-art ambulatory facility, has a small hospital, but pretty much anything you could do in an outpatient area we can do at this facility here, and it's been a great success, and we've been very blessed with the patients that come to see us there, and very blessed to have such an amazing team that leads that group every day. From a system perspective, we've built partnerships around the entire state over the past 6 to 7 years, ranging from partnerships to the North Shore with St. Tammany Parish Hospital and Slidell Memorial, west to Lafayette with Lafayette General, who will be joining and merging with Ochsner later on this year, to Lake Charles and our relationship with Christus in that area, and then Christus in the northern part of the state as well. So we really have seen like organizations that have a common view of the future that want to come together to change healthcare in the state, and we've been very fortunate to work on that. We've continued to move east. We built our first significant partnership with Rush Health System in Meridian, and you'll see more happen east of us over the next year or two as we continue to build relationships east of Louisiana. From a patient perspective, last year, 2019, 876,000 different people walked through Ochsner facilities throughout our entire system. We saw people from every parish in Louisiana, every state in the United States, and 70 countries from around the world. And you can see over the past several years, we've seen very significant growth in patients coming to see us. So when I get asked a lot, why is Ochsner growing? What's going on? It's because patients are choosing to come see us, and that's why we're building new facilities, not building new facilities and patients come. So we really are trying to keep up with the growth of folks that want to come see our physicians and see our amazing clinical team. At the same time, we've continued to grow our employee base. Today, we have about 26,000 employees around Louisiana. We're the largest private employer. So as we think about healthcare, we think about providing healthcare to our patients, but we also think about how we can provide healthcare to our own and be a great employer. And I'll talk a little bit about our investment in employees, later on in the presentation. But certainly we've seen the substantial growth, and the growth from 17 to 18 was due to adding LSU and Shreveport and Monroe to our system during that period of time. And from a revenue perspective, the Ochsner Health System revenue is just under $4 billion, with our partners that we have who are financially integrated, that we have an integrated financial relationship with them. Our revenue base will be just under $5.9 billion. We expect this to grow substantially with the addition of Lafayette General Health, which will join us, as I said, later on this year. So enough of the Ochsner commercial. I get asked a lot, why do we grow? What is the focus on growth? And the reality is we kind of look at it in a few different ways. One, we want to continue to be a destination center for healthcare. Going back to the founding of Ochsner, people always traveled from around the world, and especially Central and South America, to receive care at Ochsner. We want to be one of those top 20 or 25 places in the country that people will travel from around the world and around the country to come to. We want to focus on improving the health of our patients. And we believe that we continue to do a great job of taking care of folks, so why wouldn't we try to take care of more folks? And when we have that, what happens is more people want to come work with us. We have physician talent we see coming, and we help more communities. And these are all interrelated. And at the end of the day at Ochsner, we like to say, why do we do this? Because we want to change and save more lives. That is what we're focused on each and every day. We wake up every single day thinking about how we can get better and how we can change and save more lives, and strengthen our organization and our partners and do great things in our communities. So enough about the Ochsner commercial, enough about what's going on with us. I thought I'd give you a little bit about what's going on in healthcare, kind of in general. And healthcare is going through amazing change. There's a number of reasons for this, and I'll give you, kind of the Cliff's Notes on this. Financial pressures are driving lots of challenges for traditional healthcare institutions around the country, and I'll take you through why that is. We see more people leaving hospitals from an inpatient perspective going outpatient, and more people just wanting to be taken care of in care settings that are less intensive and lower cost. So that's why our ambulatory facility here at the Grove is pretty much all outpatient oriented. Consumer search and triage is a big deal in how people search for information today, and I'll talk a little bit about that. And we see lots of new competitors, and I'll talk a little bit about that. So first of all, once again, if you pick up the newspaper, you see there's challenges in traditional health systems everywhere around the country, going from the West Coast in California to major teaching university, Hahnemann University in Philly that closed. I mean, these are significant issues. And I get asked all the time, why is this happening? And I'm going to tell you why. 11,000 people every day in America age into Medicare, every single day. And it's going to happen for about the next 16 years with the aging of the population. You might say, okay, well, that means they need more medical care. What's the big deal? Here's the issue. The issue is the way healthcare works is commercial patients essentially subsidize Medicare and Medicaid patients and have done it for decades, and that continues to happen today. But as commercial patients and the number of them shrink and more folks go into Medicare and Medicaid, every hospital, every physician in America takes a pay cut. And it's not just Louisiana, it's not just Baton Rouge, it's not just New Orleans, it's Cleveland Clinic, it's Mayo Clinic, it's West Coast, it's East Coast, it's everywhere. So this is creating tremendous pressure on traditional health systems because this happens every single day. The other thing we see is that Medicare does not pay hospitals enough to essentially break even on folks that they take care of in the hospital. This is a chart from the Medicare Payment Commission, which I sit on. I'm one of 17 people that advise Congress on Medicare payment policy. And the challenge is, this is every hospital in America aggregated. The average loss out there is negative 10% for folks that are in inpatient Medicare payments. So you look at this and you see someone that's commercial who's profitable moving into this type of situation. It's why we have such pressure on health systems all across America. It's basically simple math. And then the other thing we see, the top chart here shows the increase in outpatient growth over the past decade, and the bottom is the decrease and inpatients. So you see more and more people moving to an outpatient area where there's lower payments and less people being in an inpatient. So if you've got a very, very large just inpatient hospital facility or footprint, you're going to be challenged because of these trends are not going to stop. They're only going to continue with technology in the future. What else is happening? New entrants, new organizations that are getting into this world. CVS opened up what they call health hubs. They start them in Chicago and Houston. They started with about 20 of them to see how they'd work. They're basically reconfiguring part of the store to be more provider-oriented, to have services for people with chronic diseases. And I heard lots of people say, oh, it's not going to work. They're not going to compete with us. They're going to open 1,500 of them this year. 1,500. And they're going to open more in 2021. And the issue here is not about, they're not going to do transplants, they're not going to do cancer surgeries, they're not going to do those things. It's all about the patient relationship. So every day, every health system that's traditional in America is in a battle for the relationship with their patients. Whether it's Amazon and their new Amazon Pharmacy, and they're rolling out Amazon Care, which is essentially going to be telemedicine and essentially chatbot to help you kind of diagnose yourself. These things are happening, and I had some people say, well, CVS isn't that strong in our area. Well, now Walmart's opened up their own standalone clinics. There's a Walmart everywhere, and these folks are coming. This is just the reality of the world we see. And so this is not going to change, and it creates even more pressure on traditional health systems. So what do you have to do? You got to be better. Every single day, you got to wake up and you got to get better. And we talk about at Ochsner, we want to be perfect at getting better. So it's being more transparent, it's having better quality and safety, it's being easier to use every single day. You got to move faster because these trends are happening every day, and you got to basically be willing to innovate and do things differently. And I think that's one of the things we've done at Ochsner. I think one of the things we're bringing to Baton Rouge, if you look at our new, the Grove Clinic, it's very technology oriented. It's very focused on how we kind of make it easier for patients to use us, and that's really kind of what we're trying to do everywhere. You got to be leaner as an organization because, frankly, healthcare is too expensive, and what we see is that more and more folks are going into Medicare, and you got to be willing to partner. No one can do this on their own. We have to be willing to be open to partner with different organizations. We've built relationships over the past 5 years with Microsoft. We've got a great cloud computing relationship with them. We're one of the beta sites for Apple and doing work with the Apple Watch. We've got relationships really across the spectrum, and that's really what we have to do. But at the same time, we also have to be focusing on how do we build not just a physical connection with folks, but a digital one. And if you look at any business out there today, whether it was Amazon and has tremendous connection to their customers via online, they bought Whole Foods because they wanted to have a physical connection to their customers as well. Walmart. 3 or 4 years ago, folks said, boy, Amazon's going to just kind of take Walmart out. It's going to be a real challenge. Walmart now has built an amazing digital business. You can just drive up and they'll put your groceries in the car. They've made it much, much easier to use them. And they've got locations everywhere. So they're winning and building the digital capability. And if you look at Target, look at their last couple of quarterly earnings, they've done the same thing. A lot of people thought Target was down and out. Their stock price is at an all-time high, and they're growing every single day because they build digital connections with their customers. What Ochsner, that's what we're focused on doing. How do we be connected to our patients? How do we make it easier for them to use us? How do we give them the things that they want to have online all the time? And then how do we continue to challenge ourselves to think differently? And I constantly challenge my colleagues at Ochsner, look outside healthcare, don't look inside healthcare. Think about the places where you go and you get amazing service, and let's come back and replicate that. Because it's not necessarily your competitor that's down the street, it's new competitors that we don't even know about or think about today. And that's how we think about approaching our organization every single day. So, with that, our focus is on having a dual strategy of physical locations that are best in quality, easy to use, have great service, but building digital capabilities and digital connections. And I'll tell you a little bit about what we're doing that from our patient portal perspective and whatnot, and how we're using data very differently today than we ever have. Now, the great thing about electronic medical records, Dr. Lin mentioned this, that today we use electronic medical records that digitizes all of our data, which is great, but that's about 10 to 15% of the value, just digitizing the data. The question is, how will we use that data to take better care of you? What if we could predict if you were going to have something happen before it happened versus have great documentation about it after? That's the challenge that sits before us today, and we have to understand we're a data company as well as a healthcare company. We have to think about how we use that data to take care of people differently. So I'll give you some examples of that. Strengthening our connection. We have almost 700,000 people that use our patient portal. We manage every day and look at how many people are using the portal, what functions they use, how frequently they use it. You can see we had a 30% jump in this from 18 to 19. Last year, 543,000 appointments were booked online with no person talking on the phone, no person coming in contact. You book the appointment when you want it, where you want it, and see that physician. And last year, we had 1.6 million messages that were answered, 95% of them same day, with people that just wanted to message our providers. This is how people expect to connect today. And I ran into this challenge, with some of my physician colleagues who are around here, and we started talking about same-day access and these types of things. It's like, this is the way of the world. It's not like we're blazing a trail. It's that we're trying to keep up with other industries and what they're doing. So you're seeing more and more happening in this area. And I didn't put the slide in here, but if our digital marketing, we've made huge investments in digital marketing. If you look at what's happening on our website traffic, it's up 300% in the last 2 years. And our physician searches are up even more than that. So once again, we're trying to put the information in front of our patients where they can see it, where they can choose what they want to do, and make sure we're putting our best foot forward, not just in the physical locations, which you can all see, and they're amazing, we want them to be, but digitally to make it easier for you to choose who you want to go to and book the appointment when you want it. I joke with people and I said, what if you called up the airline, or what if the airline said, we're shutting our website down, but we're going to put like hundreds of more people on the phones, and it's going to be amazing service, and we're going to have so many people waiting for you at the airport to help you check in. You'd say, that's ridiculous. But that's what we do sometimes in healthcare. We have to think differently, and that's how we're trying to challenge ourselves. Digital medicine. Lots of people in Louisiana have high blood pressure or hypertension. The traditional way you do this is that we'll ask you to come in every quarter. You'll walk into the clinic. We'll take your blood pressure. We'll see how you're doing. We might tweak your medicine. We'll send you on your way. The challenge is with that is it's the green bar, only about 20% or 25% of people get their blood pressure under control through that traditional methodology. Why? Because we're human. And the first week we're walking and taking our medicine and those types of things. And the second week, we're walking a little less, and then the second month, we're not taking our medicine because we forgot to get it refilled, and now, it's just a hassle. So we continue to have high blood pressure. The folks that we have on our digital medicine program, and now it's about 8,600, it'll grow to 25,000 in 2020, we basically send them home with a wireless blood pressure cuff that's synced to the smartphone that's attached to all of our hands all the time, that syncs to our medical record, and we have a group of health coaches and pharmacists that monitor your blood pressure all the time. So basically, we'll text you. If you haven't given us a blood pressure, you're going to get a text saying, haven't taken your blood pressure. Send us a blood pressure. If we don't hear from you, you're going to get a phone call. If you don't answer the phone, we're coming to see you. Right? And so we're getting, instead of 4 blood pressures a year, we're getting like 200. Now what we're seeing is 4 out of 5 people are getting their blood pressure under control. Why is this important? Less heart attacks, less strokes. We're doing the same thing in diabetes care, and we have more chronic disease modules like this coming. And with this digital business, we can take care of people anywhere, because this amazing thing called the internet, it goes everywhere. And so we've actually signed a relationship with a company that we're going to kind of be their digital medicine partner in Florida, as well as in Mississippi and Louisiana, and we look to do this in other locations as well. This is how we use data very differently. And what we can do with this information now, we can predict when people are going to go out of control on their hypertension. We can predict people who will stay in control and monitor this and folks that can't, versus using artificial intelligence and machine learning to build algorithms to look at the data and compare lab work versus how frequently you're taking your medicine or not, how frequently you're getting back to us. This is where medicine's going. And if we don't do these things, places like Amazon and Apple, they're going to figure it out and they're going to beat organizations like us and others. So we got to stay on this. The other thing is, so what's our aspiration for the future? Our focus is to make Louisiana and our patients and our communities and our employees healthier. And I don't know about you, but I don't wake up every day going, it's great that Louisiana is 49th in health status in the country. Nobody wakes up going, we're number 49. That's awesome, And in Baton Rouge, you used to be in number 1, right? Because you got the LSU Tigers here, which is great. So the question is, how do we do this? And what are the measures that go into that? So we've analyzed this, and we know that we can't do this on our own. We got to be a catalyst. We're not big enough to do this on our own, but we are big enough to be a catalyst to challenge others to do it with us. So what we want to do is first work on our employees. Make sure we're doing the right things there. Get our partners like Slidell and Terrebonne General to work with us. Get the governor and the Department of Health to figure out how they can work with us on these initiatives. And then basically work with insurers, work with employers, schools, and eventually other providers. So what would we work on? If you look at the measures of being 49th in the country, it's things that are controllable. It's smoking and vaping. It's primary care and mental health providers in our state. It's high blood pressure and diabetes and cancer screenings. We have one of the highest mortality rates in the country for cancer. It's not because we have bad cancer providers and we don't have folks that care about this. It's because we don't screen well. And we get cancer in stage 3 and stage 4, not stage 1 or stage 2. We have to change this. These are the things we can work on to change it. So at Ochsner, we manage our ambulatory quality metrics. We compare ourselves nationally to what's called the National Quality Forum. We're in the over 95th percentile in every area except cervical cancer, and I'm pretty confident we'll be there in 2020. But these numbers aren't high enough because even though you're 87% compliance for folks on breast cancer screenings, there's 13% that don't have it done. And there's cancers out there that are not being detected early enough. This is a challenge, and Jay Brooks, who's one of the best in the business in cancer, will tell us that this is something that we got to do better at. So first thing we're doing, and we actually announced this recently, we have about 22 smoking cessation clinics across the region. The drug that is best to help people quit smoking is Chantix. We're going to pay for it if people want to come in and be on the program. We'll just pay for it. It normally costs somebody probably about $1,000, but we want people to do this and quit smoking, and we want to take more locations around the region. At the same time, there's lots of folks that need social services, but they don't know what's around them. They need housing issues, or we see folks that show up in ERs that may be Medicaid or uninsured folks. They need help, they need resources, but they don't know where to go. So we're going to fund a company called Unite Us to put a platform in Shreveport, Baton Rouge, and New Orleans to start, which essentially takes all of the community resources and puts them on one platform. So anybody that's discharging them out of an ER or out of a hospital can help them locate food, shelter, counseling, other types of services. And Unite Us has done this in much larger urban areas, and will be working with us on this in these first 3 markets. So we're excited to kick this off in 2020. Then you got to invest in your employees. We raised our minimum wage about 14 or 15 months ago. It got great reviews in Ochsner. Some other folks kind of said like why are you doing this? And I testified at the legislature where this was basically voted down. And the reality, we realized that, and I'll tell you very quickly why we did this. We started a program where we could help our employees get off of payday loans. And basically that they could do a payroll deduction to get off a payday loan. The company came in, it was a company that's separate from us. They came in. So I'm like, we got a 20, I think at that point, maybe 22, 23,000. I said, maybe we'll get 400 or 500 folks. And the first 45 days, we had 2,000 people on the program. 2,000 people that had payday loans that are paying, I don't know if you've ever looked at this, I really never have. It's like 400, 500% interest. Ridiculous. These people will never get out from under this. And we said, we got to raise our minimum wage and we got to help people get assistance, and that's what the Credit Works program is. We also, at the same time, realized that we have to do more. And so we just announced this over the past couple of weeks at our kickoff meeting for our leadership. We're going to work hard to bring more people into primary care and into psychiatry in the state of Louisiana. So we are going to commit to, for folks that, and we're going to target people that are in Louisiana first, but people that go to LSU, Shreveport, or folks that basically go their third and fourth year at our program in New Orleans, our University of Queensland program, we're going to pay their medical school way if they'll make a 5-year commitment to stay in Louisiana and practice at Ochsner. So if you go into primary care or you go into psychiatry and you're one of the lucky 30, because we're going to look for the best of the best, we're going to pay your way. And for our employees, we're going to do the same thing. If we can get them into programs that they're willing to stay in the organization for 5 years and grow a medical assistant to an LPN or an LPN to an RN, we'll pay their way. And we're doing this because, one, it's such a tight labor market, but two, what I heard from employees, I did a listening tour over the past 60 days, and they said, it's great that you do signing bonuses and all that for people that are coming in, but what about the folks that are here knocking it out every day? What about us? So this is an investment in our own people. We anticipate over the next several years we'll have about 1,000 employees in these programs, and when we ramp this up for physicians, we'll have about 100 in it per year. It's about a $10 million investment, but last year, Ochsner in agency labor in nursing spent $20 million in agency labor. So this is an investment in our own future, an investment in our state. And so we're excited to launch this program. We'll start the physician program this summer with the first folks that kind of go into medical school this summer, and we'll start the employee program later on this summer as well. So this is how we start to change, I believe, our state, is through prosperity of folks that are in our organizations and by trying to have better health care and different ways to take care of people. So I'll leave you with this. How when we're successful? When our employees are healthier, our patients are healthier and more loyal, and not going to Amazon care, they're coming to Ochsner care. That our communities are healthier, and that we see that state ranking at 40th. Now, I'd like it to be better, but I'll take 40th to start with. We've been going back and forth between 49th and 50th for a decade plus. So let's go to 40, and this is kind of the focus on we can do it together. And once again, we're not going to be able to lead it all. We got to be a catalyst and challenge others to come with us and try to take this journey together. So with that, I'll stop, and I appreciate the opportunity to be here today. So. If we have time for questions, I'm happy to do it. Yes, sir.
Do you have any relationships with Pennington Biomedical that you could describe?
So we don't have relationships with Pennington Biomedical, and I think, once again, we're open to all types of different relationships. We're open to kind of working with them as well, but we do not have formal relationships. We worked on a couple of projects together in chronic care research, but I think there's probably an opportunity to do something in a much, much bigger way. So we'd be more than open to looking at that. Yes, sir.
Can you describe to us some of the advances for the future for dealing with opioids and opioid addiction?
So I think the first thing, and that's a great question around opioid addiction, I think the first thing is getting absolute transparency in how frequently we are essentially prescribing these drugs, which we've done over the past 24 months. We've seen a tremendous reduction in usage and prescriptions. I think the second thing is making sure we help folks kind of getting back to mental health. I mean, there's usually an underlying issue that's happening here. And I think we got to make sure we got enough mental health providers, enough folks that can kind of connect with people and help them sort out the things they're going to do. And that gets back to the Unite Us, investment to kind of connect community resources, because folks that are drug seeking, I mean, they come to the ER, they come to urgent care. We got Jerry Satanovich that runs our urgent cares. They try to come to primary care. And frankly, they'll keep going until they find a place that'll get a prescription written for them. So we've got to do a better job getting them into resources where they can get help. We've made bigger investments in mental health already. We've been able to do mental health hospital in Laplace, but I think we all have to work on this together. But transparency helps, and then resources for people, I think, is another step in the right direction. So, yes, sir.
Are you including vaping in your smoking cessation?
We are. We actually are now. We haven't historically, but we are going to include vaping in our smoking cessation as well. It's just, it's the new version of smoking, right? And so, and as we see, we don't even know like what all the downside damages are, but we know that it's probably not good for folks. So yes, we want to help people get off of vaping as well. There's a question way in the back there.
Great presentation. Quick question. If you had to guess overall with the whole Ochsner patients statewide, what percentage of your recipients would you say are Medicaid, Medicare, commercially insured?
Sure.
Outcomes different?
Yeah, so we actually, it's a great question. So what percentage of our patients are Medicaid, Medicare, commercial, and then uninsured? And what about quality metrics? So actually, I just looked at this the other day because frankly, we should have been looking at it a while ago, but I said, what does our ambulatory quality look like across, racial diversity? Actually, and it's pretty even. From a racial perspective. And actually, we have a couple of measures that our African American population in compliance is better than what we, especially in some of our screenings, and what we see in our Caucasian patient base. Our overall mix of patients, we're probably about 16, 17% Medicaid. We're the largest Medicaid provider in the state of Louisiana. Ochsner is in aggregate. About 40%, Medicare. Actually probably about 50% Medicare, and then maybe about 28% commercial, and then, the rest would be kind of uninsured. There's not lots of uninsured folks in the state because of Medicaid expansion, but that's roughly the numbers. So, yes, sir.
Well, first of all, thank you for recognizing the need and the challenges that our working poor face, and the program that you brought into the organization to address that.
Yeah.
For employees. Excellent.
Thank you.
I'm familiar with Unite Us, and I think it is a very good approach for you guys, because there is a gap between needs and awareness
Right.
of what's available. So just a plug for.
Thank you. And I would just say on Unite Us, that's really not, that's not just for Ochsner. Anybody, this is for anybody. What we're saying is, and frankly, I had discussions with, some folks and some insurers, and no offense to insurers, but, it's hard to get traction. I just said, we're going to fund the first 3 cities. Let's get some data that it's working, and then we'll go back and ask folks to fund the other areas. But we decided to just start there and keep going. So I'm glad to hear that you think the tool is a good one. So, yes, ma'am.
I appreciate the emphasis on primary care. Would you talk a little bit about gerontology and what's happening in that field?
Yeah, so the question is, appreciate primary care, what about gerontology? So we have a very large, Medicare population, and, we've started what we call Vantage Clinics, which are essentially our clinics geared towards taking care of seniors. Because the reality is, people that are, 50 plus, have one chronic disease. Folks that are 65 plus have, multiple chronic diseases, and you need to take care of that patient differently than you take care of, one of us. So it is, we've started these Vantage clinics. We see bringing them to all of our markets, but they're really geared towards taking care of seniors, having the right social support there, having the right health coach to be coaching them. And to be doing, reaching out to them. How are they doing? Making sure they get on programs like I talked about with our digital hypertension. We do have a program that I won't talk a lot about now, but over probably in the next 6 months we'll launch it, which is going to be more of a home monitoring system that we're building internally in our Innovation Ochsner company, which is geared specifically towards seniors and how we track seniors when they're home, especially folks that live alone. The highest readmissions of people are people that live alone. And so it's a big focus for us in the senior population.
With the experience and resources for cases throughout Louisiana, Walters Papillon Thomas Collins, LLC, is proud to support LPB, specializing in personal injury and wrongful death, with information at lawbr.net.